Hello everyone. Today I will talk about the bone tumor hemangioma. As the name suggests, heme part. Heme part means vascular part. So it's a vascular bone tumor. This vascular bone tumor can occur in any part of the body and most commonly found in the vertebra, and to be specific, in the body part of the vertebra. As we can see here, it gives a striated appearance in the vertebral body. The second most common site is the craniofacial bone, and the third site we should know is the pelvis, though it is not very common, but we should keep in mind the pelvis. Now these patients, they usually, just like any other tumor, they will follow the same natural history. Like, they begin with the asymptomatic part, then they will become symptomatic, and this symptomaticity is because of due to destruction, that is pathological fracture, or due to expansion of this tumor inside the bone. That pressure will create the pressure is responsible for the pain. The next thing we do for these symptomatic patient is we'll get an x-ray. So in x-ray we will get a striated appearance of the vertebral body. So alternate lucency and opacity is responsible for this striated appearance, or honeycomb appearance, or jail bar appearance. And an axial view, we will get a dots on end plate appearance in this typical hemangioma. Now, in any bone tumor, after after having a differential diagnosis, to make a definitive diagnosis, to confirm it, we need a biopsy. Then after doing biopsy, we will send the sample for the histopathological studies. There the finding will be the thin lined cavernous space filled with the blood. That is a typical appearance. Along with that, there will be thin blood vessels. So we'll be having a cavernous space filled with blood. Along with that, the thin blood vessels. So we have made a diagnosis here, the diagnosis of hemangioma. That's a vascular bone tumor. So the next part here is we have to treat it. For that, we'll follow the same natural history of the disease from the asymptomatic part to the symptomatic part. Now these asymptomatic part are actually diagnosed accidentally. So just like any other bone tumor, asymptomatic one, we do observation. Here we'll do the same. We will observe these tumor. For the symptomatic one, we will differentiate them whether it is accessible or inaccessible. The accessible tumor means which can be accessed by surgery. We will go for the curettage and bone grafting in accessible tumor. Those who are inaccessible, like they are in close vicinity to the nerve root or to the spinal cord, in such cases we will go for the low dose radiation, that will be 25 to 30 CGY. Now I'm showing you a case of this pelvis bone in which we are looking at the lytic lesion. Now this lytic lesion is seen in the hemangioma as well, and seen in the ABC and Paget's disease as well. But this tumor is not ABC and Paget's because on histopathological finding we are not seeing any giant cell here. So that's typical of ABC and Paget's. We are just seeing the cavernous spaces. Now the another thing is sarcoid. Why It is not sarcoid because there are no granulomatous lesion on the histopathology. The next differential for a lytic lesion we have is the chondrosarcoma, because pelvis is the common site for the chondrosarcoma, but here this is not chondrosarcoma because we are not seeing any cartilage on histopathology. now let's look at another case. Now this is the sagittal image of a lumbar spine. Now this is not Paget's. Why? Because on X-ray and CT scan, Paget's give a squared vertebra appearance. The cortex are very much thick. That is not in the case of hemangioma. So we have to keep in mind about these differentials. That's it. Thank you.